In my view, the Arnold S. Goldstein Simulation Center is the ultimate experiential learning facility. We can do things here that we can't do in any other learning environment. And to be able to do that and to do it at a place like Northeastern that truly believes and is excellent at experiential learning, it ends up being just one key piece to a much bigger approach to education.
So I think it brings out a curiosity and a creativity that's much different than what happens in the classroom. Thinking about how do you present yourself, how do you impact the room when you enter and exit, all of these really sensitive features that are best developed in place, and that develops the human-centered care that we want all of our graduates to be able to provide.
I really appreciate Arnold Goldstein's emphasis on this humanitarian component, the role that it plays specifically in healthcare, which is where I'm coming at it from, and just thinking about what all that means for educating students on communication skills.
Arnold loved academia. He loved to learn and he loved to teach. Arnold would have been thrilled to see what's going on with that simulation lab, bringing all those different schools together. Northeastern was his #1 university. Everything about Northeastern he loved. He loved the professors, he loved the school, he loved everything about Northeastern. So when I heard about the simulation lab, that was definitely the place I wanted to put my money, because I know Arnold would have absolutely loved it, absolutely loved it. He would have been down there every day.
People don't realize how much time and effort it takes to build a case. We're essentially producing a TV show, from writing scripts to setting scenes, creating environments, but they're all grounded in very specific learning objectives. 85% of medical errors come from communication problems amongst the healthcare team. So in all of our simulations, regardless of what discipline it is, we embed communication objectives in these experiences. And we can create a situation where the student has to deal with things that will happen in the real world.
So they get a lot of feedback on how they are delivering bad news to patients, for example, how they might try to manage conflict. They get a lot of feedback on their nonverbal communication, right? So we talk a lot about the importance of both the words that we use as well as the delivery that we use when we interact with others. And it allows students to make connections between class content and real encounters that they might have in their lives.
It is a critical piece of a Bouvé education that is the bridge between classroom training and co-op and real-world experience. So we can certainly design a scenario where students learn skills in a class and then come in here and demonstrate their ability to lead their team or to organize a group to come to a decision. It lets students practice skills in a setting that's safe and controlled and repeatable to make sure that they're prepared with the experiential training that they'll need long after they graduate.
This is beyond what happens in a classroom and writing a lecture. There is not another instructional facility in this college that touches every single student. And that's a gift that can't be replaced.